On this morning at 9:35, the Deputy Secretary for the U.S. Department of Health and Human Services, Eric Hargan, will join us. Matt Makoviak at 10:05 and joining us on the phones right now. Pleasure to visit with our next guest once again. Former White House physician, also candidate for Texas 13, Republican candidate for Texas 13, Dr. Ronny Jackson, joining us once again here on the Chad Hasty Show. Dr. Jackson, good morning. How are you today?
Thank you, Chad. I appreciate you having me. I'm doing well. Thank you.
Good. Glad to have you back on the show. We'll start off a little bit with just how this pandemic is evolving and what we're hearing from the administration all the way down. How do you think things are going? How do you think the response has been from the administration? And I guess what are you hearing from those in the congressional area about everything that's going on right now?
Well, I think we're in a good position right now, but unfortunately, I think we're in a position where we're about to see politics start getting inserted back into it. That's what I'm worried about. I'll tell you, the response initially was appropriate. The president, he right off the bat, he stopped travel from China and Europe, and restricted travel from Canada and Mexico. So he shut things down. That was a great initial step. Provided huge resources for state and local governments. Federal money. He engaged the private sector, got them involved in making masks and shields and ventilators and cranking out the engaging with the academic side of the house to develop medications and vaccines. He provided the initial guidance for all the social distancing that we have and stuff, pushed that out to the governors, encouraged the governors to follow the state. And I think initially it was a completely appropriate response because this was a totally novel virus that we didn't know anything about. It represented a huge threat. We didn't really know how it was going to play out, how many people were going to die. We had these models set up, that were saying that there were going to be 250,000 deaths in the United States, and that was all based on, really a lack of information. Now this is starting to play out. We can see where this is going, and we can see that this virus, it's taken some lives, and that's unfortunate. But it hasn't done what initially the models and the predictions had predicted that it would do. So now we can look back at this with some actual information. Now, it was all unknowns to start with. Mm-hmm. Now we have some knowns. And so I think we're in a position right now where we can take what we know about the virus, what we still don't know about the virus, and we can look at it in conjunction with the unbelievable impact that it's having on our economy right now, and we can decide where and when it's appropriate to get people back to school and back to work. And I think we've crossed that bridge in a lot of places in this country. I think there's a lot of places in the country where it's time for us to start sending people back to work. And, like it's been said before, maybe that doesn't happen like all at once, but, it needs to start happening. It needs to start happening now, in my opinion, to get people back, because we can deal with this virus and still salvage our economy. I'm a firm believer in that.
Well, I mean, just in the area that you're in, you're a native of Levelland, for those who don't know. We're all about small business out here, and so many of our small businesses, not only here but all across the nation, they're hurting. How much longer can they reasonably be shut down, in your opinion?
Right, and I don't think much longer, and I think it's unreasonable for us to follow that strict advice across the board right now at this point. We need to get out. If you own let's say you own a small clothing store, and you never have more than 2 or 3 people in your store at any given time, why aren't those people able to open their stores and sell their product? Right. We can do those kinds of things and still maintain a certain level of social distancing, but getting people back to work, and eventually give this a few more weeks. I've said from the very beginning that this is going to be seasonal. When the weather warms up, this is going to start petering out, and it's going to start going away, and that's what we're probably seeing right now to some extent. But I'm not going to say the social distancing hadn't had an impact. It probably has. It's probably expedited this going away, so that's a good thing. But it's time to take advantage of that now. It's time to take the next step and to figure out how we deal with the virus, but don't continue to destroy our livelihoods.
And you bring up a great point about this, possibly being seasonal. And again, we don't know for sure because it's new. But if it's truly seasonal, it's going to come back. Right. And I think a lot of people ask questions, are we going to have to go through this again? There was one model that showed that we're going to have a rolling shutdown, for like 18 months. What do you think? Are we going to have another shutdown, or are we going to be better prepared?
No. we're going to be way better prepared. One thing we're going to have is we're going to have at least 2 or 3, maybe 4 or 5 really good medications out there that are going to have a huge impact on the morbidity and the mortality of this disease. How many people it can make sick and how many people it can kill. We're going to have some medications out there that we know work on it by the time it rolls back around next time. We're not going to have the vaccine probably just yet, but it'll be close. We'll be close to vaccine development. But the other thing too that we're going to have that people don't realize right now is we're going to have a huge number of people that have had this disease, that have developed antibodies to it, that don't even know they had it or had minor illnesses, and those people are going to provide a certain level of herd immunity by the time we get back around to the fall. So I think if this comes back in the fall, we may have to take it serious again, but it won't be like this. We won't be shutting our economy down like we did this time. We'll be more prepared to appropriately deal with it based on the medications that we have and the exposure that we've already had.
Visiting with Dr. Ronny Jackson here on the Chad Hasty Show. I want to take a look at the political angle on this, and you did bring up, unfortunately, politics is going to have a part to play in all this. First, what did you mean by that? What's getting political on the national scene, in your opinion?
Well, you can see the way that they're starting the response that the Democrats are starting to have to some of the president's suggestions right now. You can see the despicable, disgusting display from the liberal press in the press briefing room, in the press briefings yesterday, and the last few times they've done it. They don't really care what's going on with this virus right now. They just care about the political impact that it's going to have potentially on the election in November. So I think that they think it's a little too early. I mean, for them right now, if we were to get this behind us right now, get our economy up and running again, and have our booming economy come back, that wouldn't be good for the Democrats, and that would pretty much seal the deal, which I think it's already done, but seal the deal that President Trump's getting reelected. So I think that they're looking at this right now, and they're saying, hey, we need to drag this out a little bit longer. This needs to move more into the summer and impact the November election in a different way. So I think that there's going to be people that don't want this to go away right now. That's very unfortunate, but that's the reality of the world that we live in right now, and some of the politicians and what motivates them. So it's sad, but it's true.
Do you think we're going to need another round of, one, stimulus for small business owners, and 2, stimulus for the average taxpayer, like what's being delivered into bank checking accounts and everything right now, and the $1,200 payments?
I think probably so. I mean, it hurts me to say that because I do not like spending money like that, and especially money that we don't have, that we're borrowing as a nation, and it's just going to drive our deficit up, and I'm not a fan of that at all. But I think if we do that, we can recover from that. What I don't want to see is I don't want to see a bunch of unrelated spending getting stuffed into these bills, especially stuff that basically that's been driven by the social agenda of the left. I don't want to see that. There were tons of examples. I'm sure we'll find out about all this other stuff that was in this $2.2 trillion bill that went out. We'll find out about stuff that was in there over the next few weeks that was completely inappropriate. But, we already know about some of the stuff, like all the money that was given to the Kennedy Center and things like that. The Kennedy Center has nothing to do with this virus. And so those kinds of things, those are, once again, another example of just kind of shameful politics that goes on in D.C. sometimes.
I got a couple more questions for you. One, we just had a listener who texted in. When do you think, as a physician, and you were talking about, reopening up businesses with social distancing, what about, for people who want to get a haircut, for nail salons and for places that do haircuts, when do you think those would be able to open back up, or are those going to take longer?
No, I think we get those going now. We do them. You do them in reasonable fashion. Spread your chairs out in the lobby a little bit. Have hand sanitizer available. If you feel comfortable wearing a mask for a week or two, just to get past all this, then do that. But I think let people get back to work. Just be smart about it.
Yeah. Another political angle on this. Obviously, you're running for office up in Texas 13. You're in a runoff up there. How do you run for office right now? I mean, it's got to change this, just the politics of everything. It's got to change how you run for office, doesn't it?
Oh, it sure does. Yeah, I mean, we've shut everything down right now in our campaign. I mean, our campaign's not shut down. We're still, we're still doing stuff behind the scenes, and we're still trying to raise a little money here and there, to keep things going, keep the lights on. But you have to put everything on hold. You have to realize there are more important things, over the last few weeks than campaigning. So the good thing is that the governor moved the election from May 26th to July the 14th. So he pushed it out pretty far.
Yeah.
So that there's time to campaign still coming up. So we've just kind of it stalled us a little bit. We've tried to stay very active in our community, volunteering and going out and helping out where we can. And like I said, we started off by trying to get blood and doing things like that. And we're going to continue to do that kind of stuff. I've been staying pretty active. I've been a surrogate for the White House on some of this stuff as far as the press goes. So I've been engaged with the White House on a daily basis. I was up there a couple of weeks ago and met with the president and the vice president and some of the cabinet secretary and some of the folks that are on the task force for the coronavirus. I'm going actually back up tomorrow. I'm going to meet with folks in the White House again, just to see what we can do, up here in this part of Texas, to get ourselves back up and running. So I'm trying to stay busy, and we'll be back on the campaign trail as soon as we can.
Excellent. Dr. Ronny Jackson, always appreciate your time, and we'll visit again soon.
Thank you, Chad. I appreciate it.
Thank you. That's Dr. Ronny Jackson, former White House physician, also a candidate for Texas 13. We'll go ahead. We'll take our break when we come back. Your phone calls and more here on the Chad Hasty Show.